Hello everyone, this is Ronnie Smith coming to you with another video update on our response to COVID at the Ralph H. Johnson VA Medical Center in all of our locations. So, update on some of our data right now. Currently we have 9 patients that are COVID positive in our main hospital here, and we continue to see an uptick in the number of PUI patients that we're following out in the community and positive patients that have either self-reported us, that have gotten a test in the community, or have contacted us and we've scheduled testing for them in one way, shape, or form, and have now come back positive. And this has been a growing trend, much like the greater community around South Carolina and Georgia that we cover. And because of this continued increase and because of our continued concerns about the impact it's going to have on our operations, on our community, and our staff, we're pausing any other future phases of our reopening plan as we further assess the situation and see the trends that are going in the community. With having 9 positive inpatients right now, as of this morning, we made the decision to reopen 4B South as our COVID med-surg unit and close down 3B South as our COVID unit. That moves us from having 6 med-surg beds available to us to having 18. Then our ICU, we had a few patients there that are ready to move to the floor, that we can move to the floor and decompress that area. But as we move forward in this, if the capacity we need continues to increase, we do have other plans available to us that where we can add more capacity if that is necessary. So we'll be watching very closely. We've actually asked services to also think about what would need to happen if we do need to decrease the number of patients we're seeing face-to-face because of the continued increase of COVID that we're seeing out in the community and the number of patients we're having to take care of in-house due to COVID. So we'll continue to monitor that and hold where we're at right now as in our phases of reopening. As the situation evolves, we'll revisit the discussion in the near future. Safety has been our most important goal as we have gone through the reopening plan and everything we've done since COVID started to try to create as a safe environment as we can for our staff and our veterans. But we've talked about this several times. One of the biggest thing we can do to protect ourselves and our patients is wearing our mask. And we've covered this a few times, but it is essential that everyone that's in our facilities, be a vendor, a contractor that's working with us, a medical student, any of our staff is wearing a mask when they're in contact with others. And they can't maintain social distancing. It is not in a private office. When they're out in public areas, need to be wearing a mask at all times. I know it is very uncomfortable. It took me a little while to get used to it myself, but it is the safest thing we can be doing for ourselves and our colleagues and our veterans. So continue to ask you to wear your mask. It is a requirement. And also the other thing is that as COVID increases, as the community's been more open up, we are also seeing an increase in employees that are reporting being sick and that we're monitoring for PUI possible testing, and seeing an increase in the number of employees testing as well. So once again, it is vitally important if you're feeling sick in any way that you contact your supervisor immediately and employee health. We've shifted a lot of providers over to employee health to assist them in their monitoring of all staff that are feeling ill and help provide the best guidance possible on how to deal with their illness in relation to COVID. So it's really important if you are talking to your supervisor about feeling sick that you also talk to employee health. Employee health will walk you through your everything, and then if you are sick, we'll give you clearance on when it would be an appropriate time to come back up. If there's a leave concern or anything of that nature, please also work with your supervisor. We have a lot of flexibilities with leave options that they can also work with HR as well to assist anyone that may need some assistance. And so we'll be continuing to follow that. And please also make sure when you're here that you're constantly washing your hands with soap and water or hand sanitizer where appropriate. And I just really appreciate everyone's work in compliance to keep everyone safe that's here in this building. And though lastly is not COVID related, but this will be my last video before Mr. Isaacs comes back next week. It has been a pleasure working with everybody when I became an acting director about 9 months ago. Still relatively fresh to Charleston and the Ralph H. Johnson Medical Center. We had just got past Hurricane Dorian and the recovery phase when it happened. So appreciate everyone's patience with me, the education they provided to me, and then working with me as I learned the facility, and also the guidance and they were able to help as I learned the Ralph H. Johnson way and what really makes this a wonderful facility. And it's really the engagement from everyone that I see around the facility and have talked to, regardless of the situation, everyone I see in the hallways that have great ideas and suggestions and ways that we can be better and help each other do our jobs. And so thank you from the bottom of my heart, and we will be seeing you again here in the near future. Stay safe, wash those hands, keep your mask on, and we'll talk to you later. Thank you.